Thank you, Madam Speaker. I rise with some concern to this bill. Many of the issues that were discussed previously in years past, both with the similar bill with children and obviously the general medical marijuana law we passed a year or two back. The real issue I think that I keep running aground on is the way we sort of jump in and jump out of our role as a state. The way we jump in and jump out of our role as a state legislature, how we are going to manage and control and govern and prescribe the way we want our citizens to be able to operate, live, behave, treat their children, treat their family members. What are we going to do? How do we do it? Now, I'm happy to see that this bill is a lot narrower and better tailored to some of the issues that were raised last year. Representative Ritter has done a wonderful job describing it, and I applaud him for that. But here we are again. We still are admittedly running afoul, well, not even arguably, we are running afoul of the Federal Controlled Substances Act that's been in force for over 40 some odd years. Marijuana or products like it are controlled, at least up until now, by the Food and Drug Administration, by the federal government. They test medicines. They test the way people are going to get medicine. They do tests to make sure what the dosages are, what the research is, what's good, what's bad, how it's done. Now, if we as a state want to say, you know what, federal government, we're going to go our own way, I think that's fine. But in order for us to do that, we've got to give some protection and some cover to our physicians, to our nurses, to our health care providers, because what we do with the medical marijuana bill, we call it a registration certificate. We were dancing around the word prescription because we couldn't use it, because it would be illegal, because doctors could potentially lose their medical license by prescribing a Class 1 controlled substance. So let's just say, you know what, we're going to take control of this, because we're a state. We control what we do here in the state of Connecticut, not the federal government. The federal government controls only what we assign to the federal government to control. That is what who we are as a nation. That is who we are as a state. The state of Connecticut is an owner of the federal government, not a subsidiary of the federal government. So with that, Madam Speaker, the clerk has an amendment. It's LCO number 4425. I ask that it be called and I be allowed to summarize.
Will the clerk please call LCO 4425, which will be designated House Amendment Schedule B.
House Amendment Schedule B, LCO 4425, as offered by Representative Shaban.
Thank you, Madam Speaker. The amendment is really pretty simple. It basically addresses, and what I believe does, it provides cover to the issue that I just raised, that our health care providers don't have to duck and cover under fancy words or misnomers such as certificate or registration certificate. They are, in fact, allowed to prescribe medical marijuana if that's what this body so dictates. Now, I might not agree with that, but what I do agree with is that if that's what this body wants, no one should be able to stop us, including the federal government. So what the amendment says is, pursuant to the 10th Amendment of the United States Constitution, and notwithstanding any federal statute or case law to the contrary, the state of Connecticut hereby reasserts and assumes authority over all regulation concerning the criminalization, growth, sale, possession, and or use of marijuana. Madam Speaker, it would be added to the back. It would be added to the back of the bill. What this does is, in fact, frankly, I'm hoping it gets accepted as a friendly amendment, because if we're going to move forward with this, let's provide our health care providers with the cover they deserve, not just fancy words and misnomers and definitions to try and duck and cover so they might not get in trouble.
Will you move adoption, sir?
I move adoption.
You have the floor, sir.
Well, man, that was a good one. I lost it. Madam Speaker, can we rewind the tape?
We have rewound the tape, so
Thank you, Madam Speaker. So, obviously, I do move adoption, and when the vote gets taken, I ask that it gets done by roll call.
The question before the chamber is on a roll call vote. All those in favor of a roll call, please signify by saying aye. Aye! In the opinion of the chair, the requisite 20% has been met. When the vote is taken, it will be taken by roll call. Representative, you may continue, sir.
Thank you, Madam Speaker. I think I've made the point. Again, this is not to be difficult. It's not to create some kind of legal quandary. What it's designed to do is to allow us to do exactly what we're doing and to raise the flag and be honest with ourselves that we, as the legislature of the state of Connecticut, which pre-exists the federal government by 100 years, have the authority to do this in our state the way we want to. The Controlled Federal Substance Act is based on the Commerce Clause. This is intrastate commerce. The Controlled Federal Substances Act is based arguably on health and welfare. This is based on our health and welfare. This is our authority, our ability, and our obligation that if we're going to pass laws like this, we're not going to leave our healthcare providers out there twisted in the wind, hoping they don't get in trouble. Madam Speaker, thank you, and I hope it's a friendly amendment. Thank you, Madam Speaker, and I thank the gentleman for his words of support, and I also thank Representative Ritter for his reflections on this. Yeah, we could probably spend a day in law school deciding whether or not having it on the paper makes it better or worse. With that, I wanted to raise the issue via this amendment because I think it's important, whether we're doing this or whether we're doing some of the other laws that we pass here. I mean, we just passed an egg bill that had to be sympathetic to federal law. We just, we passed domestic violence laws that have to be sympathetic to federal law. But then times we start passing laws like this, which we say we're not going to be sympathetic to federal law. That being said, Madam Speaker, upon reflection and discussion, because I wanted this to get discussed, I'm going to withdraw my amendment, and I appreciate the Chamber's consideration of this issue because, in fact, it's an important one and one that actually erodes our authority and, frankly, our ability to control our destiny and our funding. But with that, Madam Speaker, I withdraw my amendment.